Breast Augmentation 2019. I've gathered some information here from meetings I go to, papers I've read, papers I've written in 25 years of experience that I think you'll find the most frank, realistic, and up-to-date material you'll encounter anywhere. Let's make some decisions we're going to be happy with, not just in 6 months, but in 10 years and 20 years and more. Breast implants are the most studied device in all the history of medicine. We now have many more choices, both gel and saline implants. Let me just say, shaped or teardrop, anatomic implants, they're all going out of existence. Why are they going out of existence? It's because they and other textured or rough surface implants are related to a lymphoma, breast implant associated anaplastic large cell lymphoma. Hubbard Plastic Surgery has never used these implants, only smooth implants. Our patients of the past and all patients in the future will have no risk of this lymphoma. Smooth implants clearly own the future. Now, implants can be placed above the muscle as we see in the left, or below the muscle as we see in the right. With implants above the muscle, one must accept the trade-off of less padding, more likely to need fat grafting or placement of some type of padding to hide rippling. Also, above the muscle, patients need to accept somewhat smaller implants. So above the muscle, a woman must accept less quality in mammograms. That means more likely miss an early cancer. A study clearly showed that when implants are placed above the muscle, cancer is detected at a later, more advanced stage. Now, like everything in life, there are trade-offs. Under the muscle, there are what's called animation changes, or breast shape changes with muscle flex. The vast majority of women, though, are not bothered by this, especially with techniques that minimize it. Now let's look at the three main types of implants. We have traditional saline with just one chamber of saline on the inside. We have the ideal implant, which is more than one chamber of saline on the inside. And then we have gel, which is just gel on the inside, no saline. Now let's look at the very important happiness rate of the three different types of implants. It's basically the same happiness rate consistently in studies. I'm aware of one study showing the happiness rate of gel being higher slightly, but I also know of another study where the happiness rate of saline is slightly higher. Here we touch on briefly again what's inside the implant. Saline, it's one chamber of saline on the inside. The ideal implant has two chambers of saline, and gel has gel inside, but there are several choices of cohesivity of the gel. That is the thickness or runniness of the gel, with the most thick, least runny being true gummy bear type. Well, if the happiness rate is the same among the three types of implants, let's look at what differentiates them so we can make a good decision. Short-term and long-term, traditional saline is less costly. The ideal implant costs more initially, but it may have some cost savings long-term for a somewhat lower leak rate. Gel has considerably more costs initially and considerably more costs long-term. Let's look at another detail. Unlike saline, the ideal company does give the surgeon extra financial benefits for promoting ideal implants, and gel companies tend to give the surgeon extra financial benefits for promoting their implants. Let's look at naturalness of feel. Clearly, the thinner a woman is and the less padding of breast tissue she has, the more gel implants have a more natural feel. Once you get bigger than an A cup and some B cups, though, the difference in feel diminishes greatly. How do you monitor whether there's been a leak? With both types of saline implants, just look in the mirror and you'll know immediately. You never need an MRI scan. With gel, there is some question. It's hard to tell without MRIs. Unfortunately, MRIs are very expensive and most women don't end up getting them as recommended by the FDA. Now we realize that since women aren't getting MRIs, they probably should go ahead and replace their implants at 10 years if they have gel implants. At 10 years, probably 8% of gel implants have leaked. That's a concern, not that there will be any disease from the leakage, but the leaked gel could cause a hardening problem called capsular contracture or migration of the gel. These issues are more difficult to fix surgically. What's another way to look at leak rates and what you should do over time in the future? With saline implants, most patients will go 15 to 20 years without a leak. With ideal implants, they'll probably go even longer. These are both saline implants. And when they deflate, of course, that side of the chest will flatten, and within a few weeks you should have the implant replaced. It's really not that extensive of surgery, but it is surgery. With gel, we're back to probably needing to replace them at 10 years. With saline or ideal implants, when the leak eventually does occur, there's likely going to be some degree of discount, or if it's further out from the time of surgery, at least you'll get free implants. With gel implants, replacing them in 10 years, there's no discount, it's really full price again. If we look at capsular contracture rates or hardening rates, clearly saline has the advantage. At Hubbard Plastic Surgery, we can get the rate much less than 1%. There's something about silicone gel, though. It's difficult to get the rate of hardening quite as low. It's probably just a few percentage points higher. All women can feel their implants. Most can actually feel rippling on the inside. Occasionally, rippling can become visible on the sides of the breast, rarely anywhere else. The more padding there is, the less of a concern. It's more common with saline, but even thin women, it's only a rate of about 1 in 10. Here's a quick look at visible rippling risk. It's a little more with saline, less with the ideal saline implant, and less with gel. So how does a woman choose with so many good choices? Probably the best way is to name your top 2 priorities, and the rest will follow. There are many women worried about breast sag. There are many types of breast sag and all degrees of sag. It's part of my job to help you sort through these details. Some women clearly need a lift, some clearly don't. There's a large group of women in the middle with some sag, and with a good discussion we can make a good decision about this. We briefly touched on capsular contracture or hardening. How do we avoid it? The news is very good. It can be avoided 99% of the time using the best techniques. Many don't realize that the best technique actually came from here in Virginia Beach. Dick Mladic, I joined in 1993, originated the no-touch technique that's now used worldwide. Yes, it did come from here in Virginia Beach. We have to prevent bacteria from getting on the implant. There are many methods to do this. Among them is changing gloves. I change my gloves 5 or 6 times at least during breast implant surgery. You don't want the implant to touch breast tissue or the skin on the way in, and therefore also use a sleeve. Here is an example of a gel sleeve known as the funnel, and this is an example of a saline sleeve. At Hubbard Plastic Surgery, we do breast augmentation under general anesthesia, and it takes me about an hour and a quarter, and the stitches all go away on their own. One can return to work or school in 4 or 5 days. Sports, we need to hold off at least 3 weeks, and we do like to limit heavy pectoralis workouts during the early months. As to complications, bleeding and infection are very unusual, less than 1%. Loss of nipple sensation is not rare, but we can keep it low. There's interference with cancer detection since all implants interfere with mammograms. We can usually improve symmetry but not get it perfect. It's extremely unlikely that any disease is related to silicone, and it's unlikely breast implants will interfere with breastfeeding except with some types of lifts. Late breast pain outside the early months of recovery can occur at a rate of about 5 to 10%, usually on a scale of 10, called a 3 or 4. Pectoral strength with sophisticated studies has been shown to be decreased slightly. Stretch marks from breast augmentation is quite unusual, but there is more risk in the age group 18 to 23, especially if the woman's never been pregnant and if she's taking birth control pills. Women under 26 should probably ask our recommendations that could potentially bring the risk of stretch marks from very unlikely to extremely unlikely. SAG is related to time and tissue stretching. Larger implants probably will not help SAG at all. Larger implants also, very large implants, can lead to more problems long term. I hope I accomplished what I set out to do to give you the most up-to-date, unbiased, frank, and realistic information available. And I look forward to helping you in your journey to make the best decisions for yourself and get the most beautiful result for many decades.